I would like to start by thanking the Ministry of Rural Development in particular for all their support and for being with us for every step of the way. Thank you, Joint Secretary Sir, Monica Ma'am, Raman Sir. We've bothered you often and you've always been amazing with your feedback. Thank you to our partners, Gates Foundation, as well as, Sachi, Sudhanshu, World Bank. And I must actually thank the stalwarts of NRLM, Neeta Ma'am, Chiranjit Sir. Where the program is today wouldn't have been without you and your work on it. A special thank you to the panelists. Really, I think I have drawn inspiration and my understanding of SHGs from you. Sampath Sir, I don't know. Sampath Sir, I think you were my first introduction to SHGs. You were a mentor and later became a friend. Thank you. I think the faith I have in SHGs started with you. Smriti ma'am, when you begin talking, the rest of us keep quiet. So I think really you're all been exceedingly inspirational. I do want to thank Vruti, who undertook the survey with us. And I'm wondering if I've skipped anyone, but thank you everyone for being here. I want to mention that this is the first in our, first after a hiatus of a few years in our seminar series. The objective of the 3I seminar series was to bring together evaluators, researchers, policymakers, and other stakeholders in this space. So we are able to have a discussion, speak about new research, and understand how it can contribute more effectively and inform policy and decision making. I think it is with great pride that we say that our first event is with our NRLM long-standing evaluation. We've been doing this evaluation along with the baseline for tools for almost 10 years. So I will leave, I think, since we've started late, and apologies for that, I will leave the findings and the analysis to our principal investigator, Dr. Anjani Kochar. And yes, I did forget to acknowledge my team. And thank you to my team, including the communication office, who made this all happen and restarted this. So thank you to them. I do want to, before I hand over to Sachi, I do want to mention that there is something that's common amongst everyone present here. It is our faith in SHGs. It's our faith and in their power to bring a voice to the women, for them to be agencies of social change and have the potential also to be economic institutions. I would like to think a lot of this has been built with evidence. And with that connect, I'm hoping that we can use our discussion today to build on that evidence, to also look at areas who are future evidence and work. Thank you. With that, I would hand over to Sachi Bhalla, Deputy Director, Gates Foundation.
Good afternoon, everyone. It's such a pleasure to be here. After Nilakshi's point around our faith in SHGs, I do want to say that I think that faith in SHGs comes not just from an anecdotal experience or just sort of a sense that this is something that works, but it's really backed by strong evidence. And I do want to say that in many ways, that is almost like a unique sort of perspective that the DAY NRLM program brings. Because in its design, it is itself an iterative program. It is in its own design a program that looks at, first, let's pilot something, let's generate the evidence and the learnings, and then think about what is the scale process. Is it something that we even need to take to scale, and what are the tweaks that we might need to make to a program? What is the way in which we actually take this to scale? I think that has held this program in really the strongest sort of way possible, where we have seen the iteration, we've seen the building on institutions, we've seen the layering of effects come into place, and that's what translates into both, whether that is agency, women's agency, or it is income increase that we are now seeing come through at scale. Huge thanks, I think, to the 3IE team. Of course, to be really strong partners, to be almost like truth tellers about the program, but most critically, I think to work very closely with the program, whether it is at the ministry level, at the national level, whether it is with state partners, whether it is with the implementers, or it is a broader ecosystem of partners who can help in informing the design and also share what are nuances and perspectives that actually help in understanding the program better before you can go and actually measure it. I was specifically asked to talk a little bit about what is the relevance of NRLM and the evidence around NRLM in a larger global context. You'll hear a lot about the program. You'll hear from Dr. Kochhar about the evidence, about the focus on institutions, the model cluster level federations, the way that economic aggregation and value addition is happening, how just savings and credit in its own small way makes a huge difference in the income increases for individual women. But the importance of ensuring that there is skilling and there is access to markets in a much more intentional manner. There is the importance of a strong governance of the cluster level federations, and that's what leads to sustainable income increase and a continued path for economic prosperity. This is really critical, I think, not just for India, but also globally. In India, I think we recognize that NRLM is not just a poverty reduction program. It is actually a program of social change, and it is also a program that is putting rural societies onto a path of prosperity. And so I think understanding what has worked in the past and understanding the process of change is what will inform the future direction of the program. I think globally, something that we all recognize, India is almost unique in having an NRLM, 100 million plus women who are aggregated into collectives. Which other country has this? I think we will all struggle to think of that process and that strength that comes at a community level. But that doesn't mean that economic aggregation is not happening in different countries. I think in every economy there are aggregation points. And I think recognizing how to utilize those aggregation points to build in women's agency and livelihoods is really the task in front of us. And for that, there is already a strong process in terms of government to government connect. And I'm just going to speak to one example. The government of Ethiopia had a visit to India last year, I think in November. It was actually timed in a very critical manner. It was at a time when the design of a World Bank funded program called PSNP, Productive Safety Net Program, was actually in the form of being extended. And with World Bank support, the government of Ethiopia and the government of India actually created a holistic learning plan. That meant engaging with policymakers, with practitioners, but also with the community institutions. And I think that actually has led to the integration of those learnings, again in the form of an iterative design into the PSNP. I think that's the process that we need to actually keep focusing on. It has to be something that is rooted in evidence, but also practical learning. It also has to be owned by the government. It has to be financed. It has to be resourced in a manner that can show us what is the impact of that. And I would say what I started by saying, the iterative design of NRLM, if that can actually go into the design of other livelihood programs and rural prosperity programs, that is what is going to support other countries in actually creating their own pathways, taking the learnings from India. And I think the best part maybe in some ways, and that's selfishly as an Indian also, is to see the reference and the almost the credit that the government of Ethiopia policy notes give to the learnings from NRLM. So I think seeing that also sort of, is a moment of pride for the government of India and for NRLM to say that there is a method and there is a program that actually has global relevance. How that is interpreted and put into place in different countries has to be owned and guided by that country's own context. I'm hoping that we'll hear a lot more from this great panel that we are now going to move into after Dr. Kochhar's presentation. And continue seeing what are the ways in which we can share these learnings. One, of course, to strengthen the program and the impact it can drive for rural communities, especially for women in India. And then, of course, to take those learnings to a broader community as well, that is looking at gender equality, improved livelihoods, and prosperity.
Thank you, Sachi. May I please invite Joint Secretary Mr. Amit Shukla, Government of India. Thank you.
First of all, thank you, team International Initiative for Impact Evaluation. The apologies on me for being late. I am overwhelmed with joy on seeing my mentors out here who have been very instrumental in guiding and motivating me, and more than that, in steering the program over the past few years. So as you all know, this program has been in the works or has been implemented over the last decade and a half. It's around 15 years. And we work with this approach of, like the previous person was saying, what are the global learnings, etc. So I'll outline that we work with the approach of universal mobilization, universal financial inclusion. So the idea is that nobody should be left behind, and the scale of this always mattered. So we are moving ahead at building a very strong base, and no doubt, I mean, I was surprised on the relevance of SHG in all this. So it's now a settled question that SHGs are the building blocks. You can't take away the building blocks and then configure everything else. So why are the SHGs building blocks? This also needs to be well understood. I went into the papers, I went into some good talks on this. And then I realized that, everybody has a latent power in himself. And the more you constrain the person due to his surroundings, due to his lack of empowerments, the more strong this latent power becomes. So we in our country have a lot of people who have seen deprivation of some form or the other, and due to that, their sense of, that latent power has always desired a direction. It is this program which has enabled them to come together and realize their aspirations. We started off with some experiments and all, and then we graduated towards, women-centric self-help groups. And the learnings are very well accepted, that we have to move from, dole-based kind of thing, which was there in IRDP, to now entirely loan-based kind of a structure. We do capitalize them to some extent, like we give them revolving fund, we give them community investment fund. But then the whole idea is that they have the power within themselves. You just extend them one support and they'll be able to pull themselves out, and they'll also pull others out also. So that kind of philosophy is there. So GOI recognizes that, and the direction which we have been adopting in this program is in alignment with this kind of aspiration. Of late, you've been hearing about, so many things that we want to venture in non-farm, farm enterprises and then make it at a scale. I was reading that we have some 5 unicorn SHGs also right now. So, and on one end also, we have the pre-inclusion strategy. So it's a complete end-to-end kind of thing. We have not forgotten where we started from. That is, you need to handhold people. Those who still can't, save enough to even aspire to be a part of the SHG fold. So you have to also handhold them. You have to talk to them, guide them into this, as well as meet the aspirations of those who want to gallop, who want to go ahead. So the entire design framework has been expanding, accelerating, stretching, being made more flexible. That is the beauty of this program. So you're talking about so many people with a universal approach, and then building aspirations, facilitating them also, you're hand-holding also. So all aspects of change and all that is premised on nudges, on behavior change and so many things. So it's, I would say, apart from SDGs, it's all about partnerships and alliances, of which Gates Foundation has been one of our. We have been very fortunate to have been working with Gates Foundation. We have been fortunate to have been working with a lot of partners also. They provide us, the CBOs, the CSOs, they provide us with valuable insights and help us, network and come up with new ideas. There is, a program will always succeed if there is sharing of experiences. And in this, the role of our valued partners is immense. And it was acknowledged that we had several learnings to show to the world how we have, structured this thing together. And this financial inclusion model is very unique. It's how we have leveraged from on a ratio of 1:20 now. And we have NPAs also. Even with this leveraging, we have NPAs which are very respectable if you compare the entire world. So it is not something about a runaway credit we are talking. It's a very responsible credit-based kind of a growth which we are seeing. And there's a lot of potential for improvements, for going ahead with whatever we plan for. So now how do we look forward in the next 5 years? So what kind of activities should we be focusing on? I would request all of you to also share, but there are certain thoughts, and the key thing is, of course, don't forget that you have a foundation role to play. You have to strengthen, all the SDGs. There are some key components. You can't forget about the basic building blocks. So you have to ensure that the basic financial and institutional discipline is there, backed with. Now we are fortunate to have the IT backbone with us. It's a low-cost thing. We are building upon it. So you don't forget that part. You continue to keep on building. Then how do you further federate and how do you further strengthen the ground level organizations, of which the MCLFs have a major role to play? Now, whatever we think about, we say that it should be anchored in the MCLFs. And then can we go beyond, MCLFs also? How do we integrate these MCLFs also together? So maybe we are looking at some cluster approaches. So building up on the geographies and building about some kind of affiliations among the strong, the foci, the nuclei. So we have the foundation part, then strengthen the MCLFs. These are the most important part. Then going forward, we build up clusters. So there is a whole lot of thought on that. How do we strengthen the enterprises, both in the farm and non-farm? So all said and done, India still has a very strong agriculture-based economy, and especially in the rural areas, we shouldn't forget about it. So how do we strengthen the farm value chains, everything which is dependent upon that? So that also is one aspect going forward. Then the role of states is very important in this. So how do we capacitate them? Or rather, one strategy is how do we make them aware as to how to empower the local bodies so much that they really don't need any mission staff or something of that sort. They can do with their own set of people. So that kind of realization also has to come in the states. It is not going to be only kind of a hand-holding from the top level or at the state level. It should be that we create self-governing entities at the local level, and they in turn steer this forward. GOI always welcomes suggestions, and this is one good part, that this program has had several mid-course corrections, and GOI is not afraid of actually moving forward. There should be a kind of what should I say? If there is a suggestion for a change, then it should be really very discernible as to how it is going to lead to the improvements in terms of income improvements, in terms of changing the life of the rural poor, because that is at the bottom. That is the desired outcome. and how, we make it more, how do we make the rural growth story more resilient, more sustainable? So that is the bottom line of all this. So I thank 3I International Initiative for Impact Evaluation. It's a tongue twister. So I thank you for inviting me, and I look forward to, we are grateful to you for having conducted so many evaluations, and we have learned a lot from you. Thank you.
Thank you, sir. Are you sure it has only been a few weeks since you took charge? I think several key ideas there in terms of how SHGs and NRLM can look forward. Happy to revisit those during the panel. I now want to invite Dr. This has only gone from there. Dr. Anjani Kochar, our principal investigator. I do want to say something about Dr. Kochar and the learnings I've had from her. She's actually the institutional memory in terms of how this evolved, what even NRLM is doing. So if you want any executive instructions that you've missed, please do check with Anjani ma'am. But she's been amazing with her energy, with the way she has led this project, her insights, how she tends to frame and look at things from the perspective of a researcher as well as somebody, the bridge to policy making. I can't say enough. I'm hoping that the rest of the team has also learned from her. I do want to acknowledge my entire team. So can you just raise your hands, the NRLM team, please, very quickly. I'm sorry to put you on the spot. I love doing this. Thank you. I know the hard work you put in, and the reason my speech got cut short was because of my thank yous. But continuing in that light, over to Dr. Kochar. Thank you.
I think Nilakshi has adequately thanked all the people who are here today, but I want to personally add my debt of gratitude. All the research would not have been possible without the support of all of you in the ministry, at the Gates Foundation, and at the World Bank, and then all the people at the state governments. So it's I know it's something that you all care deeply about, and I think the way you feel about it has inspired us in turn. I also want to thank 3IE and all the researchers. So what I'm presenting here is going to be the product of the work that everybody in 3IE and Vritti, the people here from there as well, have put in. But I want to say that this is, we're approaching the end of our research agenda on NRLM. And as you approach the end of most things, you turn very reflective. And I have turned very reflective at this stage. And so what I'm going to give you is actually a lot more about my reflections. It's not going to be an academic paper. It's actually going to depart quite a bit from the studies we did, because I am looking forward. And as someone looking forward, it is acknowledging what we need to do better, acknowledging what we have done. So I hope you'll take this talk in that spirit, that this is really where do we go from here and what have we achieved. And as I said, it's more a reflection than anything else. So I've organized this talk in three ways. What have we learned about consumption growth? What have we learned about social change? And the path forward. And I started at the beginning, so I frequently go back to all the great documents that were written about SGSY, Swarna Jayanti Gram Swarojgar Yojana, at the end of it. And again, they were very reflective too. What have we done? Why have we not done better? Where do we go from here? And reading those, there are three things that were pointed out and which come back repeatedly. The first was they acknowledged that the biggest problem, the greatest difficulty, was insufficient capacity building. I'm going to be talking about that a lot. The second was why was it so difficult to build institutional capacity? And its report says this phrase that has just stuck with me ever since I read it, that the rural poor continue to remain as scattered and fragmented producers and users of services with all the attendant disadvantages and diseconomies. And the third was that the group that had been particularly left out, or not done as well, I shouldn't say left out, were the poorest of the poor, the poorest states. And it pointed out, it actually gives staggering data on how the southern states have just really improved and done well, but the states that were left behind, Assam, Madhya Pradesh, Orissa, Jharkhand, Chhattisgarh, West Bengal, and Bihar. Okay, so just putting this diagrammatically, I've lost my pointer somewhere on this. but I've organized this talk in 3 themes that I'll be returning to throughout. The first theme is persistence. Why has it been so difficult to get this change? The second is what works, which is what everybody in the academic and it's gone over to policy. Everybody's asking what works. I think the next one is much more important. We know what works, but how do we make it work? So I'm going to be dividing my time between these 3 and all the different topics. Persistence, what's come out of the SGSY report. What works is, yes, right now we know that a federation of the community institutions can have a major impact. And so that's what I take away. This is something that works, and you can go to Nigeria, tell everybody, yes, this is something that works. We've done it in India. But then there are all these intricacies of making it work. We'll see, I'm going to point out a lot of the differential returns that come from it, all these other things that we, I think, need to address. I'll be talking in terms of resources as a first thing. I'm going to be mentioning NRLM policies. So there's some policies that have worked, and that we actually have hard evidence on, causal evidence that this particular policy works. But then I'm going to be talking also about policy design. The aspects that we have perhaps neglected to think about is sort of just always there and not really, and that's, I'm going to divide my time between, I'm going to, in each case, talk about policies that have worked, but then also mention the policy designs that I think we should be paying more attention to. You've seen this. This is just a summary of all the evaluation reports. And as I said, I'm going to just build on this and go forward. The main result from the reports is that the first period of community institution building did generate improvements in consumption and in income, but these were increased much more when we went into the second phase, which was NRETP, when income projects and other projects were layered on top of it. And much of the diversification, the structural change came in the second phase, not in the first phase. That's from our reports, and so as I said, I'm not going to spend more time about it. This is going to be much more reflective and building from those reports. So what have we learned about consumption growth? As I said, I'm dividing everything into these 3 topics. Persistence, so that's the challenge of decentralized programs. What works is institutional quality, and making it work, I'm going to be talking about contextual policy design. So this is the nuts and bolts of policy, and it has to be very, very contextual, very local. So that's the sort of last theme. In this particular case for consumption growth, I'm going to be talking about the heterogeneity of returns by CLF features, and then I'm going to be talking about a particular NRLM policy which helps overcome the disadvantages of small village size, which was, front and center in the SGSY report. So this is persistence. And for this, I've taken, I have to thank MORD for making available and sharing a lot of the low-cost data. I'm going to also, at the end, I hope you'll see just how powerful that data is, because you can take a small idea and then you can show that it has ramifications for the whole ecostructure over here. So this is from that data. It's the interest income, which is with every single CLF in the country. And I'm plotting that against I mapped all the CLFs back to the villages that are their base. And so the proportion of each village that is literate, female literacy rate, and the right-hand graph is the proportion of those villages that are scheduled castes and scheduled tribes. And you can see that interest income of CLFs increases with the literacy of the villages that the CLF serves, and declines with scheduled castes and scheduled tribes. The numbers are deflated, so I put them on the same graph, and so it looks compressed, but those effects are significant and robust. So that's the persistence of CLFs, that where the villages they serve determine how effective they are, determine how much interest income they raise, and interest income, of course, is so closely tied to their sustainability. So in a sense, their sustainability is preordained. You come from a certain geography, you're going to be much more successful. You come from a disadvantaged geography, you're not going to be that successful. And that's why it's been so difficult to impact the poorest regions. CLFs are exogenous, policy-created networks. They are not natural, endogenous networks of friends. They're based on geography rather than affinity ties. And so they inherit the characteristics of the regions they serve. And they serve India's poorest blocks and India's poorest villages. So they start off as very weak institutions. Universal reach, and I'll be talking about this a lot again, that's been a mission of NRLM and a mission that I think is very important. But a universal reach requires a decentralized approach. You're not going to have enough centralized resources to serve a program that serves the whole country. And so that means that you have to develop and use local administrative capital. But if you're serving a set of villages where literacy rates are low, that's your poverty trap. How do you break out of that, and how do you make a difference? And that's why we have seen this persistence. The graphs I showed you actually go back to 2011 and say that in 2024, the sustainability of CLFs is being determined by their 2011 characteristics. So that's an incredibly persistent thing that we have to think about. How do we break that? So what works? What works is the NRLM MCLF program. So we have very strong causal evidence on that if you put in the MCLF program, it does improve institutional quality. It does it across the board. Okay. So that's a strong takeaway that we should take, that if we can put in quality CLFs, they're going to make a difference. There's significantly higher consumption growth in MCLFs relative to other non-MCLF, but also NRETP clusters. How did this happen? I would have to say that it's because it understands the limits of decentralization in a way. MCLF was a program that put in centralized resources. There's a VGF, which is not that much, but there are dedicated staff at the block level and at the district level, which are overseeing the whole program, which means that you've reduced your reliance on local staff, and you did put oversight in the hands of block and district staff. That makes a difference, particularly in the poorest CLFs. Not necessarily in all, but in the poorest, that this recognition that might be required in some cases, but not all. And continuing in that thread, this is the results we got from the MCLF evaluation, but now I've allowed for heterogeneity in the results by, again, these two measures, the female literacy rate and the proportion SCST. And so you'll see that even within MCLFs, if the CLF has a higher female literacy rate as per the 2011 census, they have done better amongst MCLFs. And if they have a higher proportion SCST, they have done worse. So persistence continues even in MCLFs, though all MCLFs have done better, but that persistence still continues. And in that sense, we have been unable to break that. So how can we make it work? What can we do different? So this is what I mean by contextual policy design. And I'm going to talk about two different things over here. The first is the variation in treatment impact by institutional size. Okay, so if I mention to any academic that India has this program that builds on a collective of community institutions, the first thing they're going to say is, that's not going to work because of the difficulties of collective action. And then to not to have this recognition of the difficulties of collective action front and center, that's something that I think can be built on going forward. Okay, so we know the difficulties of collective action. These are the free rider problems, elite capture. Free rider problems in the CLF context means that no one attends subcommittee meetings, no one goes to other things. They say, what's the point? Somebody else is going to do this. So no one is taking that initiative in the program to do anything about it. What is the solution in the academic literature, at least? It's size. Okay, that the larger the size of the collective institution, the more are you going to have these collective action problems. And the smaller is it, the better is it going to function. So considerable attention has been paid to SEG size, and we see that SEG size does stay within the limit that's stipulated. There's also a lot of attention paid to VO size. It's in a broad range, 10 to 20 SEGs per VO. But CLF size has got much less attention. Okay, so states decide that they're going to take a block and divide it into 4 CLFs. There's variation. So some states it goes up and some states goes down. But the importance of CLF size, I think, is something that needs to be emphasized a little bit more. I'm going to switch now and go on to social change, because I think the two aspects are both so important and don't want to be focusing just on consumption change because it feeds in so much. I'm going to just pick up 2 of the variables that we collected data on, social norms and food diversity, and use that as social indicators to discuss. Learnings again in these 3 categories. Persistence. So the challenge here is of overcoming where we come from, what works, going to show you that the quality of institutions works even for social change and not just for income change. And then making it work, contextual policy design. We're going to be talking again about VO CLF characteristics, but two other aspects that I hope you'll find interesting. Okay, so this is the norms, the data we gathered. We divided that up into 4 groups. So the first group, the dark orange bar at the top, is work constraining norms. This is responses to a series of questions. And the questions were things like, should a bride be allowed to work outside when she's newly married? Women should prioritize the home before they think of work. Children suffer if a mother works. So those are all just work constraining. There's a second set of work norms that are male privilege. Males should get priority in jobs, traditional occupational structure should be preserved, etc., etc. So they favor men in work allocation. There's son preference. Again, so this is son versus just general son preference. Son should get priority in schooling and food. And then there's son preference in tasks, which is more about occupations. Daughters should help mothers and sons should help their fathers. That there's an occupational division by gender, which should be perpetuated. As you can see, unfortunately, particularly for the work norms, rural India remains a regressive economy with a lot of things that we have to improve. Exposure to others, so just people joining together in self-help groups, does not necessarily cause change. So here I've taken our index of regressive norms and I've graphed it against the 2011 sex ratio. So going back to 2011, the sex ratio is the proportion of boys to total under 6 to total children. So increases in that means more regressive. And there's a strong correlation with the 2024 regressive index and the 2011, which is saying that just joining SHGs, that has not changed. Sharper evidence comes from this figure on the right. Here we collected data on the block where the women came from. And so then you can look at the impact of the sex ratio in the block that they were born and raised and compare it to the one that they're in. So if those blocks were even more regressive than your current block, what is the impact? That's the dark green line. And the dark green line says if you came from a more regressive block than your current one, you're much more likely to be holding regressive norms than all the other women around you. The impact of the current block you live in is far less. That correlation is far less. So what really determines your norms is where you came from. And that again is this persistence. Very hard to change those features. But it can be changed. And so this is the what works, the institutional quality part of it. So these are again impact results from MCLF. And you can see that particularly for work norms, MCLF did reduce that gap between your natal village block and your current one. So all those norms became less regressive with MCLF. And again, the importance of quality institution. The graph on the right is for NRETP, non-MCLF NRETP, and there's no movement there at all. So it really is the quality of institutions that matters, not just for consumption growth, but also for CLFs. How do we make it work? And here's the challenge. The social networks have to be at the same time heterogeneous and homogeneous. So you need homogeneity and you need heterogeneity. Okay? How do you do that? Well, the homogeneity is the strong collective bodies again. So if you can reduce the size, you are much more likely to have a strong collective body. And here the size that matters, you would think this intuitively and it's borne out by the data. That size that matters is the size of VOs. SHGs are much more uniform. So you can see that if you, these are against food diversity index. So VO size increases, food diversity falls, you're worse off. And so you have a greater social impact when smaller VOs that are stronger bodies. Again, on the right, there's no impact of CLF because you're really talking of the peer group level. You need that group to be different. And so that's how, again, this context matters. It matters what you're looking at. And these replicate those two graphs for NRETP and show you again that there's no impact in NRETP. The impact only comes in MCLF. What about the heterogeneity part of it? It enables spillovers from the most educated. So how are we going to get this? We get this from CRPs. Okay, so this is the data from CRPs. It shows you that they're younger than the average member. It shows you that they're far more educated because obviously education is a screening thing over here. You have to have a certain level of education. It shows you also, and this is the graph on the right, that even if you compare them to women with the same level of education, they are much less likely to hold regressive norms. So these are women who don't hold regressive norms. They're much more educated, and they can have an impact on you. And here's a graph showing you that impact. Okay, so this is the correlation between the CRP's norms and the women's norms. The stronger is the correlation, it says that the CRP is in a place to have an effect. And again, institutional quality matters. If you have a CRP and you place her in a VO or CLF that's not functioning, there are no meetings, there's no institutionalization of anything, she's not going to have an impact. But if you put her somewhere where there is room and scope to work, you know she will have an impact. I'm stressing institutional quality, and I think we can all look back on our work experiences, and we must know of institutions where we have done particularly well and other institutions where we have not done that well because of the institutional framework. And that's what you're seeing over here. How do we make it work? Again, I wanted to talk about one more thing in social change that I think is so important and explains, I have to go back a long way, shouldn't have done this, explains these results. We have an impact on work norms, but we don't have an impact on those son preference, gender norms, etc. How do we explain that? And my feeling on that is it's about information revelation. We all see the CRP working. We're all exposed to her working, and so we can understand, yeah, she can work and she can look after children, but that's something that's revealed. But we don't know what is she eating in her house, what is she doing with her children, if it's maternal and child health. Those indicators are not available to us. And so in some sense, for her to be a good leader, that information has to be revealed. I wanted to, the last of these making it work things was a two-way relationship between social norms and economic growth. So again, I come back to the gender norms. One was information revelation, but the other one was son preference. I think we need strong structural economic growth to really make a change over there. Okay? And so I think of this as NRLM's unfinished agenda. Economic interventions that enable structural change are yet to be universalized and allow large income change. We remain an agrarian economy, but the agrarian economy is not the important part of it. It's an agrarian economy that is physical labor-based. It could be an agrarian economy that's skill-based, but it's not. It's physical labor-based. And we need to make that transition for physical labor to skilled labor. Why? Unless you do, you're never going to be able to accumulate enough savings for your old age, which means you're always going to be dependent on a child. And by social norms, you're going to be dependent on a son and others. So these are just R's profiles and wage profiles, and it shows you that they remain flat with age, whereas in a wage-based or a skill-based economy, you'd have R's humping and you'd have wages humping, and that there's a period in which you can accumulate. We don't have that over here. So there's a dependence on sons for old age support that remains uniformly high across education groups, across CRPs, across non-CRPs, and the only time we see a change, this is a graph which has a household with a salaried male member in that. And it's only in this case that you see the right-hand graphs, that's the gender preference. You see a strong change in gender preference with this. The first question we have to ask for every new intervention that NRLM does, the first question has to be, how does it impact the quality of the Federation? And I'm going to call out, say, the latest program, which is the Ultra Poor program. The quality of the institution has to be front and center. And every time you write up a program for that, you should be asking yourselves, what am I doing to the CLFs that allows this? Thank you. I think we have a very interesting panel, but if there's just one or two specific on this, otherwise we should go to if there were some clarifications or anything, I'm happy to take that. Or anything else. Otherwise, you can go to the panel, I think. Anika.
So we realized that the size of the Cluster Level Federation is very important. For example, as an average of around 8,000, which is 2 years. That average is around
Exactly.
2.5 to 3,000.
Right.
But if it's too small,
right.
that also impacts?
It does. It does. So we could actually track out and trace out the optimal size and could vary by socioeconomic composition. So a large part of that, I'm thinking of the CLFs, the main goal that I think of is capacity building. So that capacity building is effectiveness in delivering training. And that will vary from place to place, but we could actually map out what is like a sensible optimal size for each. The idea you have is absolutely right. If it's too small, then why do you need that for training? If it's too small, then we are back to our scattered villages and we can't deliver training. So you need some optimal size to get around that. But if it becomes too large, people just stop showing up at meetings.
One more thing which I wanted to ask was, what is the impact of MCLFs on farm and non-farm separately? So does it help the farm cause more or the non-farm cause more?
The general impact has been in terms of, if I look at labor force participation, the increase has come in agriculture. For women, what has happened, it's agriculture and its own farm. But in essence, so there's a positive. I think our Prime Minister has talked about how the growth has come in agriculture, and he's absolutely right. From all these programs, the growth has been more in agriculture. So that's, in some sense, it's a good thing. In a second sense, it is not a structural transformation of the economy. Even though the non-farm sector has grown, that non-farm is own enterprises, livestock, dairy, etc. There's another aspect of it that I feel obliged to mention. It's been accompanied by this occupational polarization. So the men are going out increasingly, and the women are staying back in their own farms. And that, I think, again, as a researcher, it's our duty to point these out and then say, please address this problem going forward and leave it on your lap. But those are things, I think, that also have long-standing impacts. There's a growth in where male labor has grown is in the non-agricultural wage labor sector, which is important. But it means that when we think we are empowering women, we are actually sometimes empowering men a little bit more. Yeah. I think we'll turn it over to them.
Dr. Kochar, over to Mr. Raman Vadva. We're beginning with the panel, Deputy Director, Ministry of Rural Development, to introduce the panel and get it started.
Good afternoon. Good afternoon, everyone. So after this, the most dynamic presentation, which 3IE Senior Integrator? Principal. Sorry. Dr. Anjani has mentioned, I think we had a lot of learnings out of these findings and how it has to be implemented across later on. So now I've been given a task that we can have a larger discussions on various monitoring points. I would like to welcome in this panel, first of all, Shri Sampath Kumar sir, who happens to be Additional Chief Secretary, Government of Meghalaya. He is a transformative leader. We are aware of that he has led a lot of initiatives in Meghalaya, including, of course, of development sector. And these have been one of the best in the country. And of course, has given better IO leadership in the northeastern parts of the country. Welcome, sir. I would like to call upon Smriti Sharan ma'am. Smriti ma'am, we are aware of, we can say that she is also a development expert, though presently she is working only as a member for the time being, as what customer relations, customer satisfaction. I think that will also be more of community leadership per se. So we welcome you, ma'am, to this panel. I now welcome Dr. Anjani Kochar, Senior Research Fellow, 3IE. We are aware of, we heard a lot about the presentation she made. I don't know how to crisscross her.
The chairs a bit.
Yeah. Dr. Kochar has led the NRLM evaluations a lot over a period of times, and probably one of the stalwarts in the evaluation field in the country and NRLM per se. I would welcome Dr. Monica Putungru, who is a social development practitioner. I won't remind her to be a police officer as of now, and has been leading the IBCB part, FI, and an integral portion of NRLM. She is actually integrating between all the verticals of NRLM as of now. Welcome, ma'am. Now we have Mr. Sudhanshu Sharma. Sudhanshu is a key expert who has worked across in monitoring processes. Presently, he is in Gates Foundation, an MPA in Public and Economic Policy from London School of Economics. So, with this, there is only one person. Yes, ma'am, I'm coming. No, I haven't. I'm bad in all these things. So, one of the oldest but the youngest person in the group, Mr. Shantanu Kumar, a good colleague who was in the initial stages of NRLM. We look forward him to be the formal TTL also with the bank. So welcome Shantanu, and we welcome the entire panelist of stalwarts in this 3IE. A tongue twister what Ajay has mentioned. Oh, okay. So we are aware of that lot of studies, lot of evaluations have undergone in the entire system of NRLM. There have been impact studies not only in NRLM but outside world also. So it's actually what we want to discuss today is to understand how things are moving in the mission or in the country towards the development sector A. Second, we would like to understand from the panelists how these evaluations would have helped to frame the new policies, new systems, and are there any other concerns which may be of importance. So I've got set of questions to be discussed with you one by one. First of all, I'll start from the satisfaction part, that is Smriti ma'am. So ma'am, you have been with NRLM for long. You have also worked in Ministry of Agriculture per se, and in different stints. What we understand is that over a period of time, the impact evaluations which have happened, one was from the NRLM point of view, what 3IA has done. Another is you also led the next NRLM phase per se. So would like to understand what role these evaluations have played in strengthening the program design and of course furthering the implementation.
Good evening, everybody. Just two disclaimers. To be called an expert in an audience where Charanjit sir and Neeta ma'am are sitting is hugely embarrassing. So, sir, please bear with me. Secondly, Dr. Kocher, when and Anjani is also sitting there. Dr. Kocher, what I prepared today was based on my copious notes that I took when you gave previous presentations. So if there's some factually incorrect thing, please correct me. I'll stand corrected. So what I have learned from looking back at my time at MORD and the role of impact evaluation or several, I've tried to condense it to fit 2.5 minutes. So please, let's go ahead with it. It's been valuable because it helped the ministry to ask pertinent questions. And we asked what is actually driving durable changes in women's livelihood and empowerment. And I'd like to jog your memory a little because in 2011, NRLPS was launched in 13 high poverty states. And the idea was to strengthen and implement architecture in these states and to make proof of concept for capacity building, for financial inclusion and livelihood pilots. Thereafter, in 2019, we launched the NRLM. And then in 2019, we launched the NRETP. When we launched the NRETP, our focus was to have self-managed and financially sustainable federations amongst SHGs And we also felt that there was a need for digital empowerment and also to bring last mile banking services at the doorstep. And this is what led to several interventions. One was the BC Sakhi Cadre, which brought innovative financial inclusion efforts. Another unique thing which came out of earlier learning and evaluation was the model CLF, which Dr. Kocher talks about. And we had to ensure that we have some CLFs which are model and run strictly as per the NRLM guidelines. We found that clusters where MCLFs were functional with active subcommittees, not the silent ones, they perform better. And Dr. Kocher's 2024 report shows that the income gains in MCLF clusters in NRETP blocks showed a 12 to 33% growth, while the non-MCLF clusters showed only a 6 to 10% growth. So, the evidence from 3IE also showed that finance is important, but for sustainable livelihoods, we also require skills, hand-holding, investment, strong community institutions, and market linkages. There was another evaluation on MKSP, which highlighted the role of collectivization of community support. And there was another one on SWEP, which demonstrated that the importance of business mentoring, finance and market support in helping the enterprises. Evidence from impact evaluation has also brought implementation quality into sharper focus. And our experience of model CLF told us that scale creates possibility, which is what Dr. Kocher talked about in universalization, but it's the quality which creates the impact. So all this would not have been possible if we did not have a continuous flow of evidence and impact study into the program. And if I were to sum up, I'd say that evidence gathered and evaluations done, it has reinforced that there is a importance of strong community institutions which bear the fidelity of all the processes, and then we can layer livelihood, financial inclusion, and all other more nuanced aspects on it. Last but not the least, this growing body of evidence is what drives the NRLM program, and I think we should be continuing to keep doing the course correction and learning as we go forward. Thank you.
Thank you, ma'am, for those points. I think you well laid down that it's because of studies that new ideas came in, and in the end, what you summed up, that layering of livelihoods is essentially a part of that. Thank you. So with this, I would request now Sudhanshu, means of the findings from impact evaluation. Sudhanshu, you have been associated with multiple organizations. So what do you understand from this? What do you think that are the most important points in measuring the program's impact? One from point of view as a donor organization, and another from the impact evaluation analysis, which would come as part of actually, as an external eye.
Yeah, thank you. Thanks, everyone. From my point of view, actually, there is a big overlap between those, both the results that were important from our perspective from this evaluation, but also the type of results more generally. So I'll just enumerate a couple of them. One of the striking features for the set of NRLM evaluations, both the first and the second, was actually that we were able to follow the same set of about 23,000 households for a long period of time. And that helps to determine whether the changes that were noticed in the first evaluation, for example, increase in consumption and income, did this sustain over time, or what was the dynamic over long stretches of time? So that was a striking feature of this evaluation. Both of those evaluations taken together. We were happy to see that both the income and consumption gains sustained over time, and actually through programmatic innovations around MCLFs did accrue and accumulate as well. So that brought, for us, that made salient the point that the institutional quality really matters. That is something that anecdotally we had, I think that is something that we were anecdotally convinced of, that institution like cluster level federations are really important, but it was good to see that being borne out in data as well. Lastly, similar patterns on financial inclusion, right, where we saw that both saving habits and access to formal credit that was also better in areas where the institutions, namely the CLFs, were more mature. So that further underscored the importance of focusing on institutions and institutional quality. And lastly, I would say that the gaps that the evaluation highlighted as well, like for example, that there was a lot of heterogeneity in SHG bookkeeping practices. There was a lot of heterogeneity in the quality of the institutions as well, was also something that was helpful, because that's exactly where future programming and future evidence work should focus. I'll just pause here.
Yeah, thank you, Manshu. I think you mentioned, rather reiterated it well, that the same set of people bringing in better ideas out of it, and a clear picture of three important things. One was the income and consumption gains. The CLF, of course, has been talked about, and the gaps highlighted. Thanks. With this, I would like to now come to Sampath sir. Sir, you have been a leader in Meghalaya for this change. So we would like to understand from you, how has state of Meghalaya leveraged out of the community institutions, be it SHG, VO, CLF, beyond their economic activities, and rather advance toward larger development goals per se?
Thank you. Thank you. I think, are you an economist, Mr. Aman?
Happen to be.
Thank you. Great knowing about you. So, just I wanted to thank Professor Anjani for your wonderful presentation. I was just looking at it, what actually we can learn and do. I just like, before going to that question, I just wanted to make few reflections on the presentation that was made by Professor Anjani. One is that the challenge of POP, poorest of the poor, I think remain the same. I think it's a challenge. I think by seeing the data, we can see that like it's a very hard problem to really address. I think this evaluation should make us to really think about it, because I was there in 2002 in SERP. That's a first project. Like, I worked with Mr. T. Vijay Kumar and also Mr. K. Raju. So we remember like the POP was a kind of a thing, organized poorest to the poor, institution building. There was a big kind of a thing. Then but again, by seeing the data, I think it is something that it's really tough to, if you don't have a deliberate strategy. I think what you said, the elite capture, or like, maybe in terms of what, I think something is missing. And another beautiful message from you, what we also understand, small is beautiful. I think it's a very very interesting. Like we have the VO's, a size matters, CLF size matters. I think this is also something that we really have to really look at into what we are going to do. But having said this, in fact, we have we also, again, there is the challenge of NRLM is that how much we make it as a supply side program versus demand side program. So it's always the tension between supply and demand always is there. If you put more supply side, people also respond accordingly. In fact, there was a study done on, again, AP SHGs, that at some point of a time they started giving interest subventions and so many things. Suddenly they played the role of a beneficiary's role, and they're not able to bring out the agency which actually was expected to bring out while mobilizing this kind of collectives. So how do you bring the agency? Our SHGs are well-being groups. Again, Amartya Sen's development as freedom, argument. Should we actually keep them as, well-being groups, or should we actually focus, on, how do you create agency? So this debate will go on. But coming back to Meghalaya, we have I also worked outside, took a sabbatical, worked in UP for about 7 years. So outside, with a lot of, I think, Nilakshi, everyone, we all work together. So one of the things that what we have learned from that experiment was that I think there is when the institutions are really stronger, and when the autonomy is given, and provided when you provided that sensitive support organization, what NRLM is currently providing, I think then we can really see the changes, transformative changes very faster. So how I think your presentation also has shown that one. Wherever you have the MCLF, you have additional staff, additional support, then you are actually able to do it well. I think that support organization, I think while giving that, SHG should work as a decentralization autonomy, but at the same time, how actually you are aligning and how we are providing that, that supportive supervision, you call it, or how do you provide that one is also an important thing. So in Meghalaya, what coming back, we started actually taking all these examples and we are trying to expand the scope of the self-help groups, So I'll not say what we started doing, like we are seeing that self-help groups are like, in fact, it's today I said in one of other meetings, it's a new faith organizations. So Meghalaya has a lot of faith organizations. So it's a new faith organization. The faith in yourself, like, yes, you can do it. We can actually do things differently. So hum honge kamyab. So I think that spirit, I think they can actually show. So why it's a new faith organizations when we don't have that kind of a structures for learning and building that self-efficacy. I think getting that self-efficacy will happen, like I think coming together and a process, a structure, like every week you are meeting, sharing. I think that routine is actually making them as a very powerful platform. So we saw that platform. So we started actually using them for addressing a lot of other issues. First, like we started with maternal deaths, in Meghalaya. So we have a huge maternal mortality rates, in fact almost like 300 maternal mortality rate. I'm talking about 2020, and from there actually what we started, why I'm saying is like when we started looking at these self-help groups, why they were dying. Actually, if you look at, mostly mothers were dying because they were not able to access the services. And they're not able to understand that there was a problem, like by not actually, taking a decision and, there is, and avoiding the delay. So basically addressing those 3 delays, the famous 3 delays in the healthcare system. I think we started working with them. In fact, today in every health facility, SHGs run a transit home in Meghalaya. And these are run so well. In fact, some of the transit homes, they proudly say that no mother died. So, and in remote places. So they bring the mothers well in advance and, and put them for about a week or 10 days before their expected date of delivery. And then they're just next to health facilities. So they actually transfer them to the health facilities. So simple things like that. And we have about 58% reduction in maternal deaths in the last, 5 years. And then we also actually took another thing. Our malnutrition is very, very high. Our NFHS 5, the stunting rates are 46.5. And next one was no one is near 40. In no state was near 40. And then I'm talking about Burundi, the poorest state, poorest country in the Africa, has is about 56% or something. I was looking at where we are. So we started actually continuously talking about this issue, malnutrition, in every SHG meetings. It has become like, I think, VRF, and I think we used exclusively for, I think, addressing SAM, MAM and stunting issues. Today, in fact, in NFHS 6, we got the highest drop in stunting. In fact, now from 46 point, now is about 36 point something. So, and now we are just like equal to Gujarat. So I'm just putting this one because you're a competitive federalism, as told by our Honorable Prime Minister. So I'm just putting it where we are. Okay, so we are actually closer to Gujarat. So I'm just saying the reason why I'm saying is that I always say, like I ask, like how it happened. Have we changed any SNP? No, we didn't change SNP much. What we changed was only that, like monitoring, like looking at it, like and asking everybody questions, and the support provided through everybody, especially self-help groups. So the power of communities. And maybe third one can be the rotavirus vaccine health, maybe because that reduction of diarrheal diseases and all that. But my point is that this requires a multi-sectoral kind of a thing. But the power of community mobilization, is humongous, with SHG network that we could see in the results that have come up also recently. Yeah, I'll stop here because I've taken a lot of time.
Thank you, sir. I think what we talk about monitoring in the papers or in the PPTs, you have actually implemented it across, and what you mentioned, that strong institutions need autonomy, and they will bring the change. And the examples from Burundi to Gujarat, Meghalaya has reached to a better level, if I'm not wrong. So it was really heartening to hear what Meghalaya has done with the support of institutions and the kind of convergence they have brought. This is one such example we have seen. Now I would request Shantanu. Shantanu, one simple point to you from the bank's perspective or as an external agency. Which of the findings from the evaluation study do you think are most important and will be of use measuring the program's impact per se?
Thank you, sir. So actually there are bunch of such indicators and results, and like any good study, either confirms your hypothesis which you had when the project was initially developed in 2011, or rejects it. And thankfully, the design of NRLP and NRLM has largely been confirmed that this is a way to go. So for instance, even I think Professor Kocha was showing couple of minutes ago, that even the plain vanilla inclusion plus capital infusion model of the first phase led to not just consumption smoothening, but also 9.5% increase in income. That was the NRLP phase 1. But at some point you hit a plateau when you just venture with that model. And an RATP and an RLM in general pivoted to a more livelihoods-oriented strategy when Charanjit sir was there, Neetama was also there, to more an FPO, PG-led growth. And then we see marvelous results here. So one, the entire model of maintaining institutions but pivoting to a more livelihoods-oriented strategy has seemed to work. Second, when you are engaged with a project for so long as an institution like World Bank, we often get asked of questions, not just the World Bank, but ministry also. I remember Neetama and I went to Niti Aayog once, and there was a question on female labor force participation. That you're talking about, you're working with 8 crore women, and yet the female labor force participation in general has gone down. So what is your contribution? So when we see results like the NRLM model has actually improved FLFP, then that goes to show that the program has worked as well. And the third factor, which I think is crucial, is on the, and I'll reiterate what everyone has said, is on the model CLF strategy. To be honest, an RATP or any World Bank project is, from a financial resource point of view, is just a drop in the ocean. We are not there to sort of really radically alter the project budgeting. So in terms of financing, if you look at it, there's hardly any difference between a model CLF and a normal CLF. 20 lakh rupee here and there of viability gap financing, that's about it. But the rigor and the processes that were instituted through the institution of a young professional at a CLF, the visioning exercises. So those processes have actually helped in enabling MCLFs to do what they have done. So that just goes to again show that when we say an RLM, this is an accusation to us also that we're a very process heavy scheme, lots of human resource intensive scheme. Well, doing that gets you results. So I think these three results were the most encouraging for the bank, and yeah, that's it.
Thanks. I think you well laid down that processes are equally important. Nevertheless, still the question remains whether this female labor force participation has come down or not. Now it is, but still we have to work on that. So with this, I now request Dr. Monica. Ma'am, as I mentioned that you have been integrator for various kind of NRLM activities. So, and we have been talking much about the MCLF, how they have helped in higher households' incomes. So want to understand, while identifying gaps such as bookkeeping practices among members, so how are these findings being leveraged to have informed decisions with respect to NRLM's further implementation?
Thank you, Ramanji, for the question. Thank you, 3i, for having us here. And thank you, Dr. Kocher. Every time I listen to you, it adds on. There is something new I managed to understand and learn. How I understand the impact, the evaluation report is that imagine there are two sisters from the same family. They're married to two different villages, right? And they join SHG around the same time. One becomes a Lakpati Didi, one does not. It appears as a coincidence, but the evaluation report tells us exactly, helps us understand exactly this. Because the institution which one sister joined was a very strong model CLF, whereas the other wasn't, right? So the evaluation report helps us understand, and it says that households which are members of a strong model CLF, the rise in income, the improvement in income is much more, multiple times, multiple folds better than a non-model CLF federation. So the solution given is very simple. The logic given is very simple. The federation or the model CLF or an institution, it's not an accessory to the livelihoods activity which is going on. It is actually the foundation over which all our interventions are layered. Be it credit, be it training, be it market access, all this will work as good as the foundation, the institution on which it is there. So we took the report not just as a validation exercise, but we took it as a mandate for designing the future. Accordingly, over the next 5 years, we have taken up the target of expanding the model CLF from 10,000 to 20,000, doubling it. Additionally, we have decided that 500 of these model CLFs will be developed as Swabalambi CLFs or immersion sites, so that we just don't want to replicate institutions. We want to replicate the institutional capability so that the outcomes are much better as we go ahead. We understand there are challenges, as Ramanji has rightly pointed out, that bookkeeping is a challenge which we have faced even in CLFs which are in model CLF and the ones which are good. So we have tried to incorporate these feedback in our approach as we go ahead. Presently, all our bookkeeping, every SHG's account is entered in the LocOS, right? So we already have 4 to 5 lakh e-bookkeepers who have been trained and are entering this data. Parallelly, we have a community audit system. 50,000 trained community auditors verify these accounts. So it's not just for the sake of digitizing it that we are digitizing it. It is added with the accountability which comes from the community. So these are just two of the examples which have been taken from the evaluation report. We do not see evaluation as an end exercise which happens after your implementation is done. We see it as a very dynamic process which gives us design inputs so that we can scale and strengthen our future program much better. Thank you, ma'am. Evaluation is not an end, but it is giving a way forward for policy implementation or enhancing the program per se. Dr. Kocher, you have a lot of presentations and points you have made here, but one thing which everyone is looking for, and Ajay also mentioned that as the program shifts from livelihoods focus approach to the collective entrepreneurship kind of a thing. So what kind of areas of study would you recommend would be there for building evidence based for next kind of phase which NRLM is entering into?
I mean, the study remains the same. I think no matter what you're going into, so research will give you evidence on whether it's worked, but I think much more important is the things I was trying to stress over here, the nuts and bolts of why it has worked. So I think no matter what that area is, I think that's what you build on. So since I've answered the question so simply, I'll add on a reply on a different part if that's okay with you. I think perhaps where, again, just speaking for myself, if I think of all the work we have done on this, and if you ask me, where do you want to go with this? The next stage, I think, has to be dissemination and in a different way. So I hope, we spend a lot of time on this because I think if I put up a map which shows you that in this particular block, here's this, it has a much more of an effect. And somehow to be able to communicate that in an effective way, not just at this level, but at the state government level and even go down further. So you mentioned malnutrition as a problem. What if we were able to go to every woman and show her, here's graphically where your child is, and here's graphically what I know your child would be if you could do this, that, the other. So I actually worked on this a lot, that I could take your child and animated, and here's a picture of your child at this stage, and if you do these things, this is the track your child will end up in 10 years from now, and if you do these things, how powerful that would be. Yeah. So those, I think, are really what the next stage, I think, of any sort of good research partnership would be, in terms of just doing the research, but also partnering very effectively. And I think Monica mentioned, the power of LookOS, that you have all this data that allows you to take just the results from our study. I could actually project them on to every single state that we have LookOS data from and tell you, here's what goes on. And then if I go to a state government, I can tailor the presentation to the state government and say, this is what we can do in a particular state. So one thing, of course, is what is the research agenda? But I think just thinking of how can research and policy collaborate much more to sort of not just but to disseminate it and to really make a change at a lower level and use data. And no one wants to say use AI, but just use all these tools at our disposal to have much more of an impact.
Thank you. Means disseminating far behind. That is last mile delivery of the information. Thank you so much. I'll have one small round because we are left with some 15 minutes or so. So with Smriti ma'am, what would you say about how government programs should engage with and act on evidence? Lessons you would apply to beyond NRLM, what you have done?
Okay. So one can't think beyond NRLM, Raman. So one thing that I took from Dr. Kocher's presentation today is, how do we tackle persistence of various kinds? The SC/ST blocks and how they've not benefited, or the elite capture, whatever could be the persistence. So going forward, the policy should look at how this can be tackled. Another thing is that I learned from Dr. Kocher's earlier presentations was that in the model CLFs, the regressive norms have gotten diluted. There was a question of who does a woman go to? Does she have friends who she goes to? And there was an average of 2 who she could go to in times of a crisis. Also, her mindset about her role vis-a-vis the man and her status has seen a corrective action. So what I learned from here is that gender mainstreaming and more focus on gender should be going forward one of our efforts. Another thing that Dr. Kocher's study showed was that to bring growth in the non-agricultural sector, we will need more targeted livelihood interventions. Amit, perhaps that is something that would need your attention too. The MCLF has stood the test of time, as Shantanu said, and what we are looking at is we should be strengthening the MCLFs, and when Monica says that we'll even have Swabalambi MCLFs, I think we are going in the right path. The integrated farming clusters, which were located close to farm and non-farm activities, showed better backward and forward linkages. So that's where we have to look at. And I think this finding makes a great segue towards building the RPRP program, which is still in the making, but I'm sure we can work on it too. Another point, Dr. Anjani, that you made in one of your earlier presentations was that if the village market is weak and if the markets are non-remunerative, why should even an SHG woman take a loan? And if that is the case, I think we should work at strengthening the local markets. And that's where policy should really look at. Dr. Kocher, you also mentioned that the member entry and exit data shows something. Close to 10 years, after 10 years, the elderly SHG members make an exit, and there are more younger cohorts coming in. Now, that's something that we've been talking about ever since we were drafting this latest EFC, that there needs to be more focus on bringing the younger cohort and what is their interest. So we need to have policies tailored to that. We need to talk more about FNHW as well as gender. Because earlier the counterpoint was that these women are past the fecundity period. Therefore, we are not looking at these things. But no, we will have to recalibrate that. You mentioned earlier and even today that the household consumption rose to almost 10% in NRETP households. NRETP households clearly benefited from the clusters, the MCLFs. So MCLF clusters, MCLF per se really will take the program forward because they are more active and they have more rigorous procedures. Program designs for future will also need newer assumptions. And I think I look at you, Dr. Kocher, for giving us some more insights into it. But there are a couple of questions for which we perhaps still don't have answers. And this is my wish list for future research. What do we do with the older SHG cohorts? They do not have a fallback option in terms of asset creation or a fallback for old age. What is it we are doing for financial inclusion so that they can invest and not just hope that the son would take care of them? There is a greater need to focus on FNHW and gender, which came in later as a plug and play, but now it needs to be mainstreamed into the program. How do we institutionalize evidence? Why do I have to wait for 2.5 years for Dr. Kocher to come and give me evidence? Why is it that I can't have a monthly interaction, a quarterly interaction to tell me what's going right and what's not going right? Can we have an MIS policy? Related to it is that we have a wealth of data, but we do miss the API integration. If some part of the study could show that if all the data could be connected through API, what wealth of knowledge could we throw to the states? Can we do that? And in case we are not doing that, what colossal loss of resources, government resources are we into? So if we could look at that. Sampath said about the poorest of the poor. My question is, Samaveshi Ajivika has already been rolled out. It's approved. How can we study SAY and its impact? And ultimately, the real value of evidence-based studies is only when we effectively convert evidence into improved policy, implementation, and better outcomes. So I think my request would be, if we can continuously have these series. Thank you 3IE for having us here. When Dr. Kocher speaks, I always wonder, how does she get so much of insight out of crazy data? It runs into sheets and sheets. But only Dr. Kocher has that magic wand. So we need to meet more often and understand this, because that's when we start thinking. So we need to have a continuous dialogue on this. That's my wish list. And if we can bring it all together, I think the next phase of NRLM with the present team of Amit and Dr. Monica and everybody else, it would really go full steam, so to say. Thank you.
Thank you, ma'am. One fast question for Sampath, sir. How has monitoring and measurement of SAG-CLF performance on social outcomes has been developed in the state of Meghalaya? So, those use you have already shared.
Yeah, I think we have a basically we have a system. I'll tell you, instead of like we don't have any separate system. Like I think again, it maybe we can think of that one. But what we have a system of like involving a multi-sectoral, work, in the sense like we religiously monitor sector meetings. Sector meetings take place at every health facility. In the sector meeting, in the health facility, every month, health facility level, PHC, CHC level, where the medical officer, CDPO, and the BPM of NRLM, these three people have to be present. And then they discuss about, what are the high-risk pregnant mothers and what is the plan for them? How do you bring them to the transit home? What are the challenges? They discuss about it. So basically this is something that we always ask, like in our MDR, maternal death review, one of the things is that like whether she is a SHG member or not. We review and we make them accountable why the person has not been, because that simple support system is also not there for the mother to act, so one idea is that to making sure that like this is happening. In fact, we also have been designing a new project basically to just like to give more focus on this entire human development outcomes. But the other so basically making sure that like there's a multi-sectoral teams are working, and we also have a system of like the way weekly meetings, we also have a weekly field visits. This program is named as Human Development Leadership Program, where in fact again multi-sectoral teams like at a block level, they go by the data. They use the data of like the current data what we have, the RCH data and the portion data and other data. They look at where the most vulnerable households are there. Based on that, they go and spend some time, 40 minutes to 1 hour, with the most vulnerable households in the villages every week as a team, not as an individual. So suppose if they find a family with the school dropout, just go and sit there, like what are the conditions, why actually that led to a school dropout, so it's and then how actually they can collectively help them to see that like these things are addressed. So it's the idea is that how do you build that citizen state relationship, and also building that frontline state capability. So how do you build that taking charge of responsibility. So more of a practices that actually we are using. I would not say that like we are using a kind of a dashboard to see, but more our idea was actually how do you make sure that like these things are actually practiced on a regular basis. Yeah, thank you.
Thank you, sir, for sharing that process-oriented, structured monitoring and measurement, I would say, and its use case too. Thank you. Monica ma'am, only one small question from you, that what are the additional areas or studies or research evidence would you suggest for better NRLM, or instead of I shouldn't use the term strengthen NRLM. Please suggest few studies and what kind of things you look forward for NRLM in the studies processes.
Thank you, Ramanji. As we have already seen, the evaluation studies which have happened, what works, right? So the model works, that has been understood. What we need to understand is what makes it last, the long-term sustainability of it, right? So we today can very confidently demonstrate that there is improvement in income, there is improvement in livelihoods, but I'm not sure we can confidently say that the institutional capabilities or the long-term sustainability of the institutions, right? In the sense that will our SHG ecosystem sustain if the program today decides to withdraw? Those are questions which I think need to be understood furthermore. So there is a very important component called financial sustainability of an institution for it. Presently, most of our ecosystem or the cluster level federations, they survive on the income which they earn from the interest generated. We need stronger evidence to understand what group of revenue streams can lead to sustainable financial sustainability of an institution. Will it be enterprise income? Will it be service fees? Will it be integration with other schemes or other sources, right? So I think that is something which is important to understand. Additionally, I think we need to widen our horizon. We have done very close monitoring of the financial indicators, but we also need to understand the indicators which are essential for understanding the institutional capabilities. As in, is my CLF capable of mediating a dispute between two SHGs? Is my CLF capable of negotiating with the panchayat? Is it capable of convening all the concerned departments to solve a local problem? These are the things which will lead to endurance, which will lead to sustainability as we go ahead. So I'm very happy that we have proposed one evaluation study in this line so that we understand the difference between model CLFs and the other CLFs. So that is my answer. We understand the method works. We don't need validation for that anymore. We need to understand what will make it last for the years ahead. Thank you.
Thank you, ma'am. Thank you. I request Shantanu, because you have been associated especially with various kind of collectives, you have helped. So just can you suggest what kind of key evidence gaps might still be there, or they are holding them back, or what suggestions you want to give for that?
So actually NRETP did try to initiate collectives, large collectives. Bajrang ji is here. He led the large FPC program. But unfortunately, due to COVID and other reasons, it was only in the fag end of the project that we were actually able to institutionalize these FPCs. And therefore, as a result, I think in the sample, only 2% of the surveyed households had any affiliation towards any livelihood collectives, right? So I think that is a big gap. NRLP itself was designed on at least 20 years of experience in various states, back from my radar starting it in 80s. But several design principles of an RATP had not been tried elsewhere. So these large FPCs, right? We're talking about the size of the MCLFs. But what should be the ideal size of an FPO? It ranges from about 300 members in the 10,000 FPO scheme to 40,000, 50,000 members in some of our dairy FPCs. What sort of capitalization, so on and so forth. So, but these collectives are here to stay. We are taking a bet on them that this is the way to go. But unfortunately, we don't have that great deal of an evidence in terms of, if this is the right way to go forward.
Great. Thank you. So, Sudhanshu, what do you feel would be the current priorities of foundation per se with respect to group-based livelihood programs and generation and use of evidence in development sector?
Thanks. I think the evidence is quite clear and quite compelling on the role and importance of institutions. So from a foundation perspective, supporting the institutionalization, especially through MCLFs, would remain a priority. But I should also add, from an evidence perspective, we do need to do a bit of a deep dive to unpack what does it really mean when we say that an MCLF is of high quality. And I know that 3IE is undertaking some of that analysis right now. So from an evidence perspective, that would be critical to understand. We are also leaning into this shift from just pure livelihoods to collective entrepreneurship. And some of it goes back to what Shantanu was saying, helping federations move into economic aggregation models, better market linkages, and other entrepreneurship models. So that's an area that we're definitely exploring. I wanted to emphasize, it came up in remarks of many panelists, wanted to emphasize that there should be due focus on use of administrative data. A lot of things that Dr. Kocher was, some of the most insightful findings in today's presentation were actually from the LOCOS data superimposed or overlaid on the survey data. And that, I think, is the way to go in terms of analysis. So we need to broaden our view of what means, what evidence means. It is not just always conducting new surveys. It's also how do we utilize existing data? Because if you think about LOCOS, it's collecting wealth of data at many nodes, right? You have the SHG women's profile, you have Ajivika register, you have data coming in from transaction, digitization of CLFs. So a lot of data is being collected, but whether that's analyzed in a way to be able to meaningfully inform policy. And also going back to Dr. Kocher's point that there is so much heterogeneity, geographic heterogeneity, that the policy needs to be fine-tuned at a greater level of greater disaggregated level, including even at perhaps the district level or the block level. And that would be only possible if we analyze the data at that level of granularity. And very last point I wanted to make that, as Dr. Monica was saying, that the model works, that is well established. From an evidence perspective, what would be helpful is to have fit to purpose studies to see that different innovations that are happening in the NRLM, SRLM universe, what are the impacts of those and how can those be fed back into the policy and program design.
Thank you, Sudhanshu. I think we well laid down fit to purpose studies. Dr. Kocher, I shouldn't ask any question, but only a suggestion. Means, what would you like to suggest to NRLM as far as monitoring processes are concerned as of now? You have seen the women, you have seen the SHGs, you have talked about how it has evolved from CLF to MCLF. And I still recall your last presentation, not when you said that IFC should be in the peri-urban area. They worked well, the other didn't work. So what gaps do you find in the monitoring processes of NRLM, or what would you suggest how the institution can improvise?
Well, I think Sudhanshu has spoken to this, that it's not just putting the MIS in place, but it's the quality of the MIS, ensuring that the data is accurate, ensuring that the data is, I think this speaks to your point, that it has to be timely also. So if you're looking for MIS, I know the transactions data is supposed to be timely, but others are not. And then I think there's a big gap between data collection used for administrative purposes and then used in a way that can be helpful for research. So I'll go back to the MIS, for example. What would have been great, and we could have done away with that survey, is if the MIS data on CLFs, for example, had been there for 4 years. Maybe now we can build that going forward. But along with that going forward, you need that accurate date stamp. So I know that this data is 2024 and this is 2023, and that's not always there. So that detail about building that up and then building up a sustainable database which you can feed back into your studies. But I also wanted to pick up on another point that was made by a panelist, is that you do need that data coming in from everywhere. And if you can have that your collection of data, I'll give you one example because you also mentioned it on WASH indicators, food, nutrition, health. This is an area where you're not going to have success by yourself. You need to be working with gram panchayats because they're in charge of all the sanitation, piped water, delivery, etc. And what I saw, again, at a very broad level, but so interesting, gram panchayat size varies across the country. As a broad brush, you have Bihar and Jharkhand on one side, and then on the other side, you have Madhya Pradesh, so going from 1,000 to 7,000. And that GP variation had an impact on how NRLM runs its programs. If you can document that and show that and make a case for that, that is such a powerful thing to do. So one part, of course, is just the own data collection, but I think this push to somehow integrate it with other data sets.
Thank you so much. I think the stalwart panel needs a big hand for the suggestions they have made to us. Thank you all the panelists. Thank you.
Thank you, panelists. I am Ritvik. I'm an evaluation specialist at 3i, and I wanted to kind of summarize today's discussion. There are a lot of takeaways made by this honorable panelists, and the onerous task of highlighting the key learnings has come on me. So I think we have a lot to learn. Many of the findings resonate the findings of our evaluation. I think we spoke a lot about the focus on quality of these institutions and how these strengthening of these institutions like MCLF leads to improvements of program outcomes. There was also this discussion around how much and how we should build these institutions, especially around the platform of the economy and its wider repercussions for the economy around it. Also, Sriti ma'am rightly point out on the focus on capabilities and how we are going to reach out to these institutions more widely. Another important point, highlight for further study is need to understand the role of markets and how to bring these markets and the households together for the wider economy and also increasing the program outcomes. And also, I think one point that Sriti ma'am pointed out is how to convert this evidence into effective policy dialogue and the need to have this kind of evidence seminar on a periodic basis. I think that's it from our side. We thank you for your kind presence, for devoting our time. We have tea and snacks outside, so we would request you to join us and spend a little more time with us. Thank you.